experiencing difficulty in reducing your creatinine levels despite your diligent attempts, your solution may be readily available in your vegetable storage area. It is noteworthy that certain vegetables may contribute to the reduction of elevated creatinine levels, facilitate detoxification processes, diminish inflammation, and promote overall kidney health. However, it is important to note that not all vegetables possess the same nutritional value. What dietary choices can support optimal kidney health during times of need? Presented below are 5 highly beneficial vegetables that are not only safe for renal health, but also offer significant support to kidney function. This video provides guidance on methods to reduce creatinine levels. You will gain an understanding of the physiological processes within your body, identify the most essential nutrients, learn optimal cooking methods to preserve their renal benefits, and recognize a prevalent error that may be hindering your desired outcomes. Let us begin by discussing an often overlooked vegetable that can contribute positively to renal health: onions. While they may appear unassuming, these small bulbs are rich in antioxidants. It is important to consider methods that may assist in lowering creatinine levels and providing support to kidney function. Quercetin, an antioxidant found in onions, has been shown to potentially reduce oxidative stress and inflammation, both of which are significant contributors to the progression of kidney disease and elevated creatinine levels. By mitigating inflammation, kidney function may improve due to reduced strain. May I inquire about your current situation? Additionally, please feel free to ask any questions you may have before we proceed. If you have any inquiries, please feel free to leave a comment below. Please remember to subscribe and activate notifications to ensure you receive all of Seniorhealth's valuable health tips. Additionally, onions enhance the body's antioxidant defenses, contributing positively to renal function. These contain vital nutrients, including iron, folic acid, and vitamins A, B6, C, and E. It is important to note that this provides approximately 14% of the recommended daily intake of vitamin C, in addition to around 167 mg of potassium and 29 mg of phosphorus. 1 cup of sliced onions contains beneficial compounds that can be incorporated into a kidney-friendly diet. The fiber present in raw onions may assist in the elimination of toxins and potentially lower creatinine levels. Additionally, onions have properties that can contribute to the management of diabetes and hypertension. They may naturally reduce blood pressure and enhance insulin sensitivity, which are significant factors in the context of kidney health. Therefore, there are compelling reasons to consider including onions in your dietary regimen. Incorporating them into your regular meal preparations can be highly beneficial. Currently, a significant number of individuals incorporate onions into their culinary practices. The method of preparation can significantly impact renal function, particularly in cases where the kidneys require additional support. Adhere to these straightforward recommendations to ensure your onions remain suitable for kidney health, allowing you to reap their advantages without any adverse effects. It is advisable to consume onions in their raw form whenever possible. By following this approach, you can maximize your intake of quercetin and sulfur compounds, which are beneficial for mitigating inflammation and enhancing overall health. In terms of insulin function, it is advisable to choose yellow or red onions over white onions. Yellow onions contain a significantly higher concentration of antioxidants, with some studies indicating they may possess up to 11 times more than other varieties. Add garlic and herbs to the olive oil and proceed to sauté the onions. This enhances the flavor profile while minimizing the addition of excessive sodium or unhealthy lipids. It is advisable to avoid frying onions. The addition of extra calories and unhealthy fats not only contributes to an increased caloric intake, but also diminishes the beneficial properties that contribute to the health benefits of onions. It is advisable to moderate your sodium intake in your meals. It is advisable to exercise caution with onion consumption. Excessive salt intake can elevate blood pressure and exacerbate renal issues. While onions are highly nutritious, overconsumption may result in gastrointestinal discomfort, such as bloating, gas, or halitosis. A moderate intake of a couple of tablespoons of chopped raw onion per meal is generally sufficient for most individuals to reap the health benefits without adverse effects. It is considered safe to consume up to 1 cup of sliced onions daily, particularly when cooked, as this preparation method enhances digestibility. However, it is important to note that excessive raw onion consumption may lead to certain undesirable effects. Halitosis can present with an unpleasant odor. The sulfur compounds present in onions are responsible for lingering in the oral cavity and may enter the bloodstream, subsequently influencing the odor of exhaled breath. Consuming apples may assist in neutralizing sulfur compounds. Incorporating fresh herbs such as mint or parsley into your diet, along with adequate hydration post-meals, may contribute to alleviating this issue. Consuming raw onions can provide various health benefits. However, it is advisable to maintain oral hygiene by brushing your teeth and tongue immediately afterward to mitigate any potential impact on breath freshness. Additionally, garlic has beneficial properties that may support kidney health. Incorporating onions into your diet can significantly contribute to maintaining healthy blood pressure levels and supporting renal function. To enhance the absorption of antioxidants in your body, consider incorporating vegetables rich in vitamin C, such as bell peppers, or simply add a squeeze of lemon juice for optimal benefit. Transitioning from the beneficial properties of onions, it is important to highlight another vegetable that may be advantageous for kidney health, particularly for those aiming to naturally reduce creatinine levels and safeguard renal function. Would you like to understand what it entails? Let us discuss the nutritional and culinary aspects of eggplant. Have you ever encountered the vegetable known as eggplant? Have you ever considered the influence of specific dietary choices on your creatinine levels? If that is the case, it may be prudent to reassess the situation. This unassuming vegetable may serve as a valuable ally for renal health. Individuals with renal concerns may find that consuming raw eggplant is a prudent dietary choice, as it contains approximately 188 mg of potassium and 19 mg of phosphorus per cup. Additionally, it contains vitamins C and B6, which support immune system function and cognitive health while also reducing inflammation. Manganese is also present in that composition. Are you aware that manganese is essential for the metabolic processes involved in the breakdown of carbohydrates, fats, and sugars? Additionally, it contributes to the regulation of cholesterol levels and blood glucose levels in the body. Ensuring adequate manganese intake may enhance immune system function, promote bone health, and potentially improve renal function. Additionally, eggplant contains folate, which plays a crucial role in DNA repair and the production of healthy red blood cells, essential for individuals experiencing fatigue and kidney-related concerns. Additionally, eggplant is rich in anthocyanins, compounds that may contribute to a reduced risk of specific health issues. This intervention is effective in reducing the risk of myocardial infarctions and cerebrovascular accidents by maintaining vascular health and inhibiting the oxidation of low-density lipoprotein cholesterol. Additionally, it is beneficial for maintaining stable blood glucose levels and provides enhanced renal protection due to its fiber content and low glycemic index. Allow me to demonstrate an optimal method for preparing eggplants that is gentle on renal function. This approach preserves essential nutrients while slightly reducing potassium levels, making it suitable for individuals with kidney concerns. If you are committed to utilizing nutrition for therapeutic purposes, this recipe is essential for your consideration. Before initiating the cooking process, please follow these preliminary steps. Clean the eggplant thoroughly, then proceed to remove both ends. The skin is consumable, however, it may present a degree of toughness. You may choose to peel it if preferred. To mitigate the potential bitterness of eggplant, it is advisable to apply a light sprinkling of salt and allow it to rest for approximately 30 minutes. This method minimizes oil absorption and aids in mitigating bitterness. It is advisable to thoroughly rinse off the salt prior to the cooking process. Additionally, ensure that your oven is calibrated to the appropriate temperature. Begin by setting the oven temperature to 450 degrees F. Carefully bisect the eggplant longitudinally. In a mixing bowl, combine 1 clove of thoroughly mashed garlic with 1/2 cups of olive oil. Apply this garlic oil onto the eggplant by either drizzling it over the surface or using a brush to ensure even coverage. Utilize 3 fresh thyme sprigs, applying gentle pressure with the back of a knife to facilitate the release of their aromatic compounds. Subsequently, position them atop each half of the eggplant. Place the eggplant halves, with the cut side facing upwards, on a baking sheet and roast for approximately 45 minutes, or until they become tender and begin to. When the eggplants exhibit a brown coloration, it indicates they are fully cooked. Prior to serving, apply a fresh squeeze of lemon juice over each half and season with black pepper and smoky paprika according to your preference. This straightforward yet flavorful recipe not only enhances your meal, but also serves as a beneficial option for kidney health. It is important to note that eggplants contain oxalates, which may contribute to kidney stone formation in individuals predisposed to this condition. Additionally, those adhering to a low-potassium diet should monitor their intake. For optimal kidney health benefits, moderation is advised. It is advisable to limit your consumption of eggplant to approximately 1 cup, 82 grams, or half of a medium-sized eggplant. Research indicates that eggplants and onions may have beneficial effects on kidney health. However, there is additional information to consider. Garlic is a vegetable that not only offers a robust flavor profile, but also provides significant benefits for renal health. If you are seeking a solution that may assist in reducing inflammation, maintaining optimal blood pressure levels, and enhancing insulin function, this represents a commendable initial option. Garlic is among the most beneficial vegetables for kidney health that you likely have in your kitchen. Allicin is a significant compound that contributes to the support of renal function. The potent compound responsible for garlic's distinctive aroma and numerous health benefits is produced when fresh garlic is chopped, crushed, or chewed. Allicin enhances the kidney's ability to eliminate waste products, potentially resulting in reduced creatinine levels in individuals experiencing renal issues. Additionally, it functions as a natural anti-inflammatory and antioxidant agent. Garlic is beneficial for renal health. This intervention aids in preventing additional harm to renal tissues and diminishes oxidative stress, which is typically elevated in individuals with chronic kidney disease. Additionally, garlic exhibits mild diuretic properties, facilitating the kidneys in the excretion of excess water and toxins, such as urea and creatinine via urine. This represents a significant improvement for individuals experiencing elevated creatinine levels or fluid retention. This intervention aids in the reduction of elevated blood pressure, a significant factor contributing to and resulting from renal complications, by promoting the natural relaxation of blood vessels. Garlic plays a role in maintaining stable blood sugar levels, which is crucial for individuals with diabetes to support kidney health. Despite its modest size, a single clove of garlic is rich in essential nutrients, providing significant health benefits. Consumption is entirely safe, as it contains merely 4 mg of phosphorus and approximately 12 mg of potassium. Additionally, this provides approximately 7% of your daily folate requirement and 9% of your daily vitamin B6 intake. Although the figures may appear modest, they significantly impact kidney patients by facilitating the production of red blood cells and promoting nerve health. Garlic offers numerous benefits for overall health and muscular function. Additionally, the cumulative effect of consistent daily intake can be significant. Various types of garlic offer distinct advantages for nutritional value and renal health. Therefore, it is essential to analyze these differences comprehensively. Fresh garlic is the optimal choice. It is of superior quality. Crushing or chopping this substance maximizes its allicin content, thereby providing optimal protection for renal health. This ingredient can be incorporated into soups and stews, blended raw into dressings, or sautéed for enhanced flavor and texture. Dried garlic is available in the form of granules or powder. While it may not possess the same potency, it offers a level of convenience that is noteworthy. It is advisable to limit the intake of garlic salt due to its high sodium content, and the process of drying garlic may diminish its advantageous compounds. Lastly, there is minced or chopped garlic preserved in oil, typically found in a jar. While it may be convenient, individuals with renal concerns who must monitor their sodium intake should avoid it, as it frequently contains preservatives and additional sodium. What would be the most appropriate option to consider? Raw garlic. When utilized appropriately, it is the optimal approach. This product contains a highly concentrated form of allicin, providing a comprehensive array of essential nutrients. Would you prefer it prepared in a cooked state or served raw? Raw garlic contains the highest concentration of allicin. However, its potent flavor and aroma may not be suitable for all individuals. When preparing garlic for cooking, it is advisable to crush or chop the cloves and allow them to rest for approximately 10 minutes prior to the cooking process. In this manner, the allicin can completely mature prior to the application of heat, which may lead to its degradation. Subsequently, you may incorporate it into rice dishes, soups, or vegetables following a brief sauté in olive oil. What is your assessment of that? Concerned about the presence of garlic odor in your breath? There is no need for concern. This is a completely normal occurrence. The sulfur compounds present in garlic have the potential to persist in the oral cavity and may also enter the systemic circulation. To address the odor, consider chewing on fresh mint or parsley immediately following your meal. Consumption of green tea may assist in mitigating unpleasant odors as well. It is important to ensure proper oral hygiene by brushing both your teeth and tongue regularly. For a rapid revitalization, consider rinsing with a solution of lemon juice and water. A quantity of 1 or 2 cloves of fresh garlic is sufficient. Garlic is often considered to be safe and potentially advantageous for the majority of individuals diagnosed with chronic kidney disease. It is advisable to limit the intake of garlic powder to no more than a quarter teaspoon per day, ensuring that it is free from added salt. What are the potential adverse effects? Garlic is generally considered safe for consumption. However, certain individuals may experience adverse reactions, particularly when ingested in its raw form. Frequently encountered concerns encompass mild abdominal discomfort, flatulence, dyspepsia, and halitosis. In uncommon instances, excessive amounts may lead to blood thinning. Therefore, it is advisable to exercise caution if you are currently undergoing pharmacological treatment. If you are currently prescribed anticoagulants or have an upcoming surgical procedure, it is important to consider incorporating cabbage into your dietary regimen. Its applications extend beyond salads and side dishes. Cabbage is rich in essential nutrients and has a low potassium content, rendering it an excellent option for individuals aiming to maintain optimal kidney health. Are you seeking clarification on the matter? Let us proceed with a thorough examination. Cabbage contains a significant concentration of beneficial compounds known as phytochemicals. Studies indicate that these natural substances may assist in preventing chronic diseases such as cancer and potentially slow their progression. Certainly, the following is the translated content. Cabbage is a nutrient-dense vegetable, rich in vitamins K, C, folate, and B6. These essential nutrients contribute to vascular health, mitigate inflammation, and offer protection against oxidative stress. Notably, a single cup of chopped cabbage provides approximately 54% of the recommended daily intake of vitamin C, which is beneficial for enhancing immune function, reducing uric acid levels, and supporting renal filtration. Additionally, it contains around 151 mg of potassium and 23 mg of phosphorus per cup, underscoring its value as a healthful vegetable. For individuals experiencing renal issues, there is an intriguing development to consider. Additionally, research indicates that the beneficial components in cabbage may assist in regulating blood sugar levels and preventing weight gain. Both of these factors can significantly impact renal health. Currently, cabbage is available in a variety of colors, including red, white, green, and Napa. Red cabbage contains a high concentration of antioxidants, surpassing that of other varieties, and all types offer health benefits. The presence of anthocyanins in this substance is beneficial for cardiovascular health and may offer protective effects for renal function. The deep purple hue is indicative of underlying tissue damage. White and green cabbage are prevalent varieties, characterized by their milder flavor profile while still being rich in essential vitamins. If you are beginning to incorporate cabbage into your diet, it is advisable to select the green variety. For those seeking an additional source of antioxidants, red cabbage presents a commendable choice. When selecting cabbage, it is advisable to opt for specimens that exhibit firmness and density, characterized by tightly packed leaves. It is advisable to refrain from selecting any specimens exhibiting a slimy exterior, the presence of soft spots, or brown discolorations. Upon returning home, please place your cabbage in the refrigerator for optimal preservation. Crisper compartment. When stored appropriately, a whole head of cabbage can remain viable for up to 2 weeks. Both raw and cooked cabbage offer distinct benefits. Raw cabbage retains a higher concentration of vitamin C and enzymes. Cooking the food can enhance its digestibility and may reduce the levels of goitrogens, which can adversely affect thyroid function if consumed in excessive amounts. The optimal methods for preparation include stir-frying, sautéing, or lightly simmering the ingredient. To maximize the potential health benefits, it is advisable to alternate between raw and cooked options throughout the week. We shall proceed to the next topic. Enhance the nutritional profile of cabbage with a preparation that is both palatable and beneficial for health. Prepared to enhance your renal health while adding flavor to your culinary experiences. This stir-fry is poised to become your preferred choice. To prepare this, you will require half a cup of grated carrots and 1 cup of shredded green or red cabbage. It is advisable to include a squeeze of lemon juice, a pinch of turmeric, a dash of black pepper, and a teaspoon of olive oil in your preparation. It is permissible to incorporate a finely chopped onion as well. If you enjoy garlic, consider adding a clove. Begin by heating olive oil in a pan. Once the garlic reaches a golden hue, proceed to incorporate the carrot and cabbage into the mixture. Cook the vegetables in a stir-fry for approximately 5 minutes, ensuring they become tender while retaining a slight crunch. Subsequently, incorporate black pepper and turmeric, allowing the mixture to cook for an additional minute. Add a small amount of lemon juice, and the preparation is complete. This dish is a flavorful and crunchy stir-fry that is gentle on renal function and beneficial for detoxification processes. For individuals experiencing renal complications, a daily intake of half to 1 cup of either cooked or raw cabbage is generally considered safe and beneficial for health. The administration of preventive nutrients maintains potassium concentrations at or below 150 mg per cup. Following the preparation of that nutritious cabbage dish, are you still contemplating ways to incorporate additional kidney-friendly foods into your diet? Green beans provide a range of nutritional benefits. This vegetable may assist in reducing creatinine levels and promoting kidney health. Let us explore its remarkable advantages. Their capacity to mitigate oxidative stress and assist in detoxification is the primary focus. Consider the beneficial compounds, such as chlorophyll and flavonoids, among others. Green beans are rich in vitamin C and antioxidants, which contribute to the protection of renal cells. Additionally, they are beneficial due to their content of B vitamins. This provides approximately 9% of the recommended daily intake of folate and 5% of the recommended daily intake of vitamin B6. These vitamins facilitate the body's ability to metabolize proteins more efficiently, thereby minimizing waste products such as creatinine. Additionally, green beans contain a modest amount of iron, which plays a crucial role in the production of healthy red blood cells. It is essential to sustain optimal cellular health and to prevent anemia, a condition frequently observed in individuals with kidney disease. Maintaining balanced iron levels facilitates the transport of oxygen to the kidneys, thereby alleviating stress on these organs and potentially delaying the necessity for treatment. Additionally, there are further considerations to take into account. The potassium and phosphorus content in green beans may be unexpectedly high. 1 cup contains approximately 209 mg of potassium and 38 mg of phosphorus. Consuming a cup, or even half a cup, of green beans daily may contribute to enhanced kidney function and a reduction in creatinine levels. It is noteworthy that individuals diagnosed with diabetes may experience significant advantages from incorporating green beans into their diet. These substances assist in maintaining stable blood glucose levels and mitigating fluctuations, as they possess a low glycemic index of approximately 32. These are an excellent choice when combined with other carbohydrates due to their high fiber content, which effectively slows the absorption of sugars. When selecting green beans, it is advisable to choose those that exhibit firmness and crispness. Freshness is paramount. Avoid any specimens that exhibit signs of spotting or wilting. To promote optimal digestion, it is advisable to thoroughly cleanse the items, remove the ends, and then savor the experience. In the process of preparing them, it is advisable to segment them into smaller portions. It is advisable to select plain frozen green beans, avoiding those that contain any flavors, sauces, or added sodium. Avoid canned products as they typically contain high levels of sodium, which may elevate blood pressure and contribute to fluid retention, particularly in individuals with renal complications. What is the most effective method for preparing green beans? Various cooking methods such as boiling, sautéing, grilling, or stir-frying can be employed for their preparation. I recommend trying the steamed green beans with lemon and olive oil. However, to preserve the majority of vitamin C and antioxidants, begin by rinsing and trimming a cup of fresh green beans. Steam the vegetables for approximately 5 to 7 minutes, ensuring they reach a tender consistency while retaining a slight crunch. During this process, prepare a dressing by combining 1 tablespoon of fresh lemon juice, 1 tablespoon of olive oil, and 1 teaspoon of sea salt. Upon completion of the cooking process for the green beans, apply the lemon dressing uniformly over the beans and proceed to place them in a serving bowl. Add a selection of fresh herbs. Parsley contains a significant amount of antioxidants, while the addition of extra virgin olive oil contributes healthy fats, enhancing the potential benefits for kidney health. It can be incorporated as a complementary side dish to any meal that is suitable for kidney health. Most individuals with kidney conditions can typically consume approximately half to 1 cup of cooked green beans daily without adverse effects. If you have concerns regarding the consumption of green beans, rest assured that the majority of individuals with renal conditions can tolerate them without significant issues. It is important to note that raw green beans contain lectins, which are natural proteins that, Consuming a significant quantity of them in their raw state may lead to gastrointestinal disturbances and interfere with the body's nutrient absorption processes. Opt for steamed or lightly sautéed green beans rather than fully cooking them, as extensive cooking may diminish their nutritional benefits. The 5 vegetables that may assist in reducing creatinine levels are outlined in that source. However, please hold on. Cucumber is another vegetable that may assist in reducing creatinine levels more rapidly. Let us promptly examine the crunchy cucumber salad, which is one of the optimal and highly recommended preparations for cucumbers. Obtain approximately 2 cups of fresh cucumbers. Add 2 teaspoons of Caesar or Italian dressing to the cucumber slices. Subsequently, add freshly ground black pepper according to your preference. Combine the cucumbers and dressing in a medium bowl, ensuring it is adequately covered, and proceed to shake the container thoroughly to achieve a uniform mixture. Incorporate black pepper into the mixture, refrigerate it for optimal chilling, and savor a refreshing salad experience. If you found this information beneficial, please consider indicating your approval to receive additional straightforward advice regarding kidney health. There is a significant amount of additional information and developments forthcoming to arrive.